Imagine you are at home, relaxed, watching TV or scrolling through your phone, when suddenly something strange begins to happen. A crushing pressure settles in your chest, as if a giant rock had just fallen on you. The air starts to vanish, your left arm goes numb, your vision blurs, and cold sweat runs down your forehead. In that moment, you realize what is happening. Your heart is failing. And the worst part, there is no one around. You are completely alone. The question becomes inevitable. What would you do if you had just 10 seconds to save your life? Most people believe that, in that situation, the only option is to hope for a miracle. But the truth is different. There are emergency techniques, so simple yet so powerful that they can give your heart a real chance to keep beating, even if no one is there to help. Techniques that have been documented, studied, and applied by doctors and survivors all over the world. Actions that, if you know them and practice them, can make the difference between reaching a hospital alive or not making it at all. I am Dr. Manuel Barragán, a cardiologist with more than 47 years of experience across Latin America and Spain, and also a heart attack survivor. 3 years ago, I was in the exact same situation. My life was hanging by a thread while I was home alone. I remembered a protocol I had taught my patients for decades and applied it. That decision gave me vital seconds. I managed to hang on, call 911, and survive. Today, I want to share those same techniques with you. They are not generic advice or empty promises. They are 3 concrete actions that anyone can perform in less than 10 seconds, and they may be the difference between life and death. Stay until the end, because what you will learn today could save your life or the life of someone you love. Technique 1. Coughing hard. The first technique may seem too simple to be real, but it is precisely that simplicity that makes it one of the most powerful tools when the heart begins to fail. Strong, controlled coughing. When we think about heart attacks, most people imagine calling 911, asking for help, or waiting for a defibrillator. But what happens when you are alone and cannot even speak or move? In those seconds, your only defense may come from inside your own body, your ability to create pressure in your chest through a deep cough. Picture your heart as an electric motor. When its rhythm is interrupted, it is like the internal wires stop transmitting energy. A defibrillator applies a shock that resets that electrical system. While a strong cough can create a similar effect. By compressing the chest abruptly and repeatedly, you stimulate the heart, trigger changes in internal pressure, and in some cases, force the cardiac muscle to recover its normal rhythm. And how do you do it correctly? Here is the step-by-step. Step 1, inhale deeply, filling at least 80% of your lungs. Feel the air expanding your chest. Step 2, close your mouth and, using all the strength from your abdomen and diaphragm, cough violently. This is not a timid or shallow cough. It should sound like a sharp blow, like an internal burst. Step 3, repeat once every 2 seconds. Keeping a steady rhythm for a minute or until you stabilize. Now you may be asking, can a cough really save my life? The answer is yes. The American Heart Association has documented that this technique can increase survival by more than 30% during the first seconds of a heart attack, especially for people who are alone and cannot access immediate medical help. This method is effective while you are still conscious and able to recognize the early symptoms: crushing chest pain, shortness of breath, dizziness, numbness in the left arm, or pressure in the jaw. If you detect these signs, acting quickly can make the difference. Let me share a brief story. A few years ago, one of my patients, Jose, 55 years old, was alone in his workshop when he felt an intense pain in his chest. He remembered what I had taught him: cough hard. He did it once, twice, 3 times. The pain eased just enough for him to dial emergency services. Paramedics arrived in time and confirmed he had suffered an acute heart attack. Jose always says those coughing seconds were his second breath. But here is the most important part. Coughing is not a cure. It is an emergency resource. It does not replace a defibrillator or an ambulance. What it does is buy you time to stay conscious, to oxygenate your brain, and to call for help. Of course, There are warnings. People with fragile bones or lung conditions should be careful, as coughing too forcefully may cause rib pain. And this should never replace a medical diagnosis. Even if symptoms ease, the heart attack may continue silently. Now think about this. How many people in your family would know how to react if they heard that a strong cough could keep someone alive during a heart attack? Probably very few. That lack of knowledge is what costs so many lives each year. That is why I insist, not only should you learn it, but you should share it. Teach it to your partner, your children, your parents, your neighbors. Because for you it might be just an interesting fact, but for someone else it could be the knowledge that saves their life. Always remember this phrase. Strong coughing is your first line of defense. It may sound simple, but in the first seconds of a heart attack, simplicity is power. Technique 2, direct chest strike. The second technique is even more striking because it is not about coughing or breathing, but something much more physical, hitting the center of your chest. It may sound drastic or even exaggerated, but in the first seconds of a heart attack, this action could be the only thing that keeps your heart beating. Why does it work? Because right in the center of the chest runs a vital pathway of the heart's electrical system. When the heart goes into fibrillation or starts to stop, a precise strike in that area can create enough electrical stimulation to restart the system in a way very similar to what a defibrillator does. In emergency medicine, this is known as the precordial thump, and although it is not a permanent solution, it can buy valuable time. Picture the scene, someone alone collapsing to the floor with crushing chest pain, almost losing consciousness. Coughing is no longer possible because energy is running out. That is when this technique becomes the last spark to reignite the heart's engine. Let me tell you the story of Esteban Cordero, a 79-year-old man from Rosario, Argentina. One early morning, he felt such an intense pressure in his chest that he could not even breathe. He tried to cough, but he had no strength left. His vision was fading, and dizziness dragged him into unconsciousness. He remembered a medical talk where I mentioned this method. With his last bit of strength, he clenched his fist and struck his chest once, twice, 3 times. On the 4th attempt, he felt an internal jolt, as if his heart had suddenly awakened. That action gave him enough seconds to call 911. Doctors later confirmed he had suffered an acute heart attack, but thanks to those strikes, he made it to the hospital alive. How do you apply this technique correctly? Step by step. Step 1, clench your fist firmly, as if you were about to punch a boxing bag. Step 2, locate the exact center of your chest, right over the sternum on the imaginary line that connects both nipples. Step 3, use the lower edge of your fist, the side beneath the pinky finger, and strike sharply downward like using a hammer. Step 4, do it once per second, repeating 5 to 6 times. Never more than that, to avoid injury. A strike that is too weak will have no effect, but one that is too strong in the wrong spot can cause damage. That is why precision is key. Studies conducted in Germany showed that nearly 20% of patients in cardiac arrest regained consciousness, thanks to this technique applied within the first 3 minutes. However, it is crucial to understand this is not a technique to be used lightly or practiced unnecessarily. It is an emergency resource to be applied only when you are alone, aware that your heart is failing, and you no longer have the strength to cough. Think about this for a moment. Would you rather risk a chest strike or do nothing while your heart shuts down? Most people do not know this option exists, and that ignorance is why thousands die without attempting the one thing that might have given them a few extra seconds. If you ever need to use this technique, remember, the goal is not to cure yourself, but to buy time. Time to stay conscious, to stabilize your heart momentarily, and to allow medical help to arrive. Here is something I want you to keep in mind. Practice mentally where to strike. Place your hand on the center of your chest and remember the sensation of clenching your fist. Because in a real emergency, panic takes over, and only what you practice beforehand will come back to you. Strong coughing is your first defense. The chest strike is your second most direct opportunity. 2 powerful weapons in the battle of the first 10 seconds. Technique 3, the hegu point. The third technique comes from traditional Chinese medicine, but over the years it has been studied and recognized in modern clinical settings. It is called stimulating the hegu point, an acupressure method that can help stabilize your heartbeat during a heart attack, especially when you no longer have the strength to cough or strike your chest. You might be thinking, how could pressing a spot on my hand help me survive? The answer lies in the connection between the nervous system and the heart. The hegu point, also known as hegu in acupressure, is located on the back of the hand in the space between the thumb and the index finger. Applying firm pressure here activates a nervous reflex that can improve circulation, reduce physiological anxiety, and regulate heart rate. Picture this scenario. You are alone, dizzy, your vision begins to fade, and you cannot cough or strike your chest, yet you still have some mobility in your hands. At that moment, pressing the hegu point can buy you precious seconds to keep your heart beating and give you time until help arrives. Step by step, here is how to use this technique. Step 1, look at the back of one of your hands. Step 2, find the space between the thumb and the index finger. Feel where the bones of those two fingers meet. Step 3, slide the finger of your other hand slightly toward the index side until you find a small hollow. That is the hegu point. Step 4, use the thumb of your opposite hand to press firmly on that point. You should feel slight discomfort or pain. That is how you know you have found it. Step 5, hold the pressure for 5 seconds, release for 2 seconds, and repeat for 1 minute. Alternate between both hands to prolong the stimulation. And what does science say? Studies from hospitals in China and South Korea have shown that stimulating the hegu point can lower blood pressure, stabilize heart rate, and improve brain oxygenation in emergencies. It does not replace a defibrillator or medical treatment, but it can keep you conscious and give your body an extra chance to resist. Let me share a real story. One of my patients in Madrid, Maria, 62 years old, began to feel chest pain while home alone. She had once heard me talk about the hegu point and decided to try it. She pressed firmly while breathing deeply. That gave her just enough time to remain conscious until emergency services arrived. Later, she told me, "Doctor, I felt like that pressure in my hand kept me awake, as if my body was holding on to life." Of course, there are important warnings. This technique does not replace calling for help. Do not think that just pressing this point will solve everything. It is a support resource, not a definitive solution. It also should not be applied too gently, because it will not create the needed stimulus. The key is firm pressure and consistency during those critical seconds. Think about this. How many times do we use our hands without realizing the hidden power they hold? This simple point tucked between two fingers can become your best ally in the hardest moments. And the best part is, anyone can practice it starting today. Strong coughing was your first defense. The chest strike, your second chance. And the hegu point is your third tool, the one that steadies, calms, and sustains you until help arrives. In less than 10 seconds, these 3 techniques form an emergency protocol that can make the difference between life and death, precautions and common mistakes. Now you know the 3 techniques that can give you valuable seconds to survive a heart attack when you are alone. But there is something you must understand clearly. These actions are not a medical treatment, they are emergency resources. Their main function is to buy you time until professional help arrives. And because they can be so powerful, they also require precautions. Number 1, always call emergency services. The most important thing is that as soon as you have even the slightest chance, dial your country's emergency number 911 in the United States and Mexico, 112 in Spain and much of Europe, 123 in Colombia. Even if you manage to stabilize for a moment, the heart attack can continue silently and cause irreversible damage. Number 2, do not ignore the symptoms. Many people make the mistake of thinking the pain will go away on its own. If you feel chest pressure, shortness of breath, dizziness, or numbness in your arm, do not downplay it. Every second counts. Even if the symptoms ease after using the techniques, you still need to go to the hospital. The relief may be temporary, and heart damage may still be advancing without you realizing it. Number 3. Be careful with excessive force. The coughing technique should be done with energy, but not to the point of injuring yourself. Older adults or those with lung problems should adjust it to their capacity. The same applies to the chest strike. Too weak will not work, but too strong in the wrong spot could fracture ribs or damage nearby organs. Number 4, do not replace prevention. Another common mistake is thinking these techniques are an absolute shield. They are not. They work in an emergency, but the real protection lies in prevention. Moderate exercise, healthy eating, controlling blood pressure and cholesterol, avoiding tobacco, and limiting alcohol. Number 5, practice ahead of time. In a real emergency, panic can block your mind. If you have never located the EGU point, practiced a deep cough, or clenched your fist, chances are you will not remember how to do it in the critical moment. Rehearsing today means being prepared tomorrow. Number 6, do not act with overconfidence. The last mistake is believing these techniques make you invincible. Do not fall into the false security of thinking, if I have a heart attack, I already know what to do. Remember, these are lifelines, not cures. Use them responsibly, always combined with an immediate call to emergency services. Used incorrectly, they could put you in greater danger. Used correctly, they could give you the opportunity to stay alive. Long-term prevention. Up to this point, we have focused on what to do in the first 10 seconds of a heart attack. But the truth is, the greatest victory comes long before the emergency ever happens. It is called prevention. Long-term habits are the real shield that can drastically reduce the chances of your heart ever reaching a critical point. Prevention begins with movement. Even 30 minutes of moderate exercise at least 5 days a week can strengthen your heart, improve circulation, and regulate blood pressure. Walking, swimming, or cycling are not just routines, they are medicine for your heart. Nutrition is another key pillar. A diet rich in vegetables, fruits, whole grains, and lean proteins helps reduce cholesterol and keeps your arteries clean. Avoiding excess sugar, salt, and saturated fats is just as crucial. Think of every meal as a choice. Will this plate protect your heart or burden it? Tobacco and alcohol are silent enemies. Smoking damages arteries and accelerates heart disease, while excessive alcohol strains both the heart and the liver. Quitting tobacco completely and limiting alcohol to occasional use is one of the most powerful steps you can take for long-term protection. Do not forget the role of stress. Chronic tension raises blood pressure, triggers inflammation, and wears out the heart over time. Techniques such as deep breathing, prayer, meditation, or simply spending time with loved ones are not luxuries. They are vital strategies for keeping your heart resilient. Finally, regular checkups are non-negotiable. Monitoring cholesterol, blood pressure, and glucose levels with your doctor allows you to catch silent risks before they become fatal. Prevention is not about fear, it is about awareness and action. When you combine healthy habits with knowledge of the 3 emergency techniques, you build a 2-layer defense, one that keeps your heart strong every day, and one that gives you precious seconds if crisis strikes. Prevention is not just about living longer, it is about living stronger, healthier, and with peace of mind. Long-term prevention. So far, we have talked about what to do in the first seconds of a heart attack, when everything becomes urgent and life depends on quick action. But the truth is, the most powerful thing you can do for your heart is not just reacting in an emergency, but preventing that moment from ever coming. Prevention is the most effective medicine, and the best part is, it is in your hands. Number 1, move every day. The heart is a muscle, and like any muscle, it needs exercise. You do not need to run marathons or lift heavy weights like a professional athlete. Walking for 30 minutes a day, taking the stairs instead of the elevator, or stretching when you wake up are small actions that bring enormous benefits. Regular physical activity lowers blood pressure, improves circulation, and strengthens the heart. Even dancing, cycling, or playing with your kids counts as exercise. Number 2, watch what you eat. A balanced diet is the fuel that keeps your internal engine stable. Cut back on processed sugars, saturated fats, and excess salt. Add more fruits, vegetables, fish, and nuts. Remember, every meal can be either a remedy or a silent poison. A colorful plate is usually a healthy plate. Number 3, avoid tobacco and limit alcohol. Smoking multiplies the risk of heart attack. Every cigarette damages your arteries and hardens your blood vessels. If you smoke, the best day to quit was yesterday. The second best day is today. As for alcohol, excess is a silent enemy. It affects blood pressure, the liver, and of course the heart. Number 4, control your emotions. The heart does not just respond to biology, but also to what you feel. Stress, anxiety, and bottled up anger are like invisible weights pressing on your chest. Learn to breathe deeply, take breaks, and sleep well. Caring for your mental health is caring for your heart. Number 5, get regular checkups. Many people only find out they have high blood pressure, diabetes, or high cholesterol when it is already too late. A simple medical exam can detect problems before they turn into emergencies. If you have a family history of heart disease, be even more careful and maintain strict control. Remember this: surviving a heart attack is possible with the techniques you have learned, but the most valuable thing is to prevent it from happening at all. Your heart is with you every single day of your life. Give it the attention it deserves, and it will reward you with years of health, energy, and well-being. And never forget, a heart that is protected is a heart that is prepared. We have reached